Today we're joined by Dr. Joseph Pergolizzi, who's a pain specialist and well-versed in multiple issues confronting people experiencing acute and chronic pain, and he's here to discuss the 4 surprising sources of pain and how you can tell if you're experiencing pain that is viral-related or from another source. Welcome to the show.
Oh, thank you very much, and a real pleasure to be here.
So can you tell our audience how you know if your pain is caused by a virus or something else?
That's a great question, particularly in light of this pandemic that we're having with COVID. And I've had a lot of people come and tell me that, hey, during COVID, I've had these strange symptoms, and could they be attributed to the virus? So let's step back for a second and think of that. We know the virus can affect nerves, particularly the nerves that come out of your brain, what we call the cranial nerves. People have told me that they have loss of smell. And this has been a big problem because they'll have this symptom for beyond the time that they may have the acute viral problems with COVID. So when we get infected, our system gets infected with the virus, the immune system works to fight that infection. And this fight could lead you to feel muscle inflammation and weakness, which we call myositis, or joint and muscle pain, which we call myalgia. And this is the typical manifestation. And on top of that, sometimes when you have this type of pain, it's going to be more broadly dispersed around your body. So it's not really going to be maybe focused in just one joint or just one muscle in your body. So it's more of that diffuse type of pain. It usually comes along with this feeling of weakness or muscle or joint pain in the form of myositis or myalgia.
What are some unusual sources of muscle pain that could be caused by a stressful lifestyle?
That is a really great question. You know, every day we deal with life issues which could cause lesser known causes of muscle pain that could be confused with symptoms of other medical conditions like viruses that we just talked about, but are actually, somewhat a result of that daily hustle and bustle of life. There are 4 unusual sources of muscle pain that could be brought on by a stressful lifestyle or an inactive lifestyle. Those are stress, dehydration, poor nutrition, and lack of sleep. And think about stress. Well, issues related to COVID, issues related to the everyday financials of life or interpersonal relationships. Stress definitely can be one of those unusual sources of muscle pain. Dehydration. It's always something that we need to consider. We need to be drinking and keeping ourselves rehydrated a lot. Poor nutrition. Try not to eat too much of the sugar goods. Try to eat types of fruits and vegetables and meats like salmon with alpha omega fatty acid that can be helpful for you. Lack of sleep. I think we all can use more sleep. And it's these 4 surprising sources that, when in combination, can even make that type of unusual muscle pain worse. Now, put that on top of someone, let's say, who unfortunately contracts COVID-19. The stress level is definitely up there. You're probably dehydrated. You're not eating like you should, and you're lacking more sleep. So you could see how we can get into a downward spiraling effect.
So what are some easy ways to get rid of muscle pain that doesn't involve pills or a doctor's appointment?
This is a very common question. And there are, in my opinion, at least 3 easy ways to address these types of muscle pain at home or on the road that could save you a doctor's visit. And they include muscle relieving stretches or exercises, actual official stress breaks from what you're doing, and natural topical pain relievers. So if we look at each one real quick, pain relieving exercises are very important. I can't say enough about a day to gym or going for a walk, particularly when you're pinned up. So you need to take time to exercise. And it can be simple exercises. There's a technique called grounding, where you just take your shoes and socks off and you connect with the earth and you stretch those feet and you walk around. Stretch breaks. Sitting at the desk all day or traveling on long flights or in the car, you really should take a stretch break. And you can do some of these stretches right in your seat at your chair. Where you take off your shoes, you place your ankle on top of your opposite knee, and you just stretch it and flex it, and you do that from side to side. You bend and you stretch back and forth, but take a break and stretch, and that's a good idea. It improves circulation, it increases your flexibility, and it's good for your overall body and muscle tone. And then finally, natural topical pain relievers are a great first-line therapy. These type of over-the-counter medicinal rubs, they do help. They target the pain right where it is. So, the joints that are close to the skin surface, such as the knees, elbows, they can absorb topical pain relievers relatively quickly and show positive effects faster than most oral pain relievers. Also, you can use another dose of a topical pain reliever usually more quickly than you can take a second dose of most oral over-the-counter medications.
So when and how should medication be used for muscle pain?
When it hurts, especially when the pain interferes with your activities of daily living. You can't move around, you're stiff, etc. Based on this, what I usually suggest to people is that they first need to perform some type of assessment of your pain, right, using a scale. So it's not uncommon we talk about pain scales, 0 to 5, 0 to 10, with 0 being the worst, and maybe 0 being no pain, and maybe 10 or 5, depending on what scale you use, being the worst pain. So if we use a 0 to 5 scale, 0 no pain, 5 the worst pain, you want to see where you are. And based on this, you can decide what type of action you need to take. Now, if you have a pain rating that's 5 and a pain that hurts, especially when you are doing activities, this is when you really need to go and see someone to help you. And it can be any type of medical health care provider. And that's how you could start to first judge it. Look, the pains that are of a lower ranking, a lower severity, these pains, a topical rub may be the right idea. And I actually always start with a topical pain medicine that is used by the patient. It can be administered a couple times a day in the area where it hurts. And this is what a lot of pain doctors like myself, in a recent survey done, showed us suggested first-line therapy for at-home care.
So when should a person see a doctor about muscle pain?
When we think about what necessitates seeing a physician, I like to look at what we call red flags and yellow flags. A pain rating that's very high. Again, that scale 0 to 5, with 5 being the worst pain ever. That's when you want to go to see and seek medical care. When it hurts, especially when the pain interferes with your activities of daily living. And when you think that there may be other types of problems going on, like redness or swelling in the area. This is, again, one of those other red flags that we need to be familiar with. Another one might be overall general feeling of weakness or inability to move any part of your body. Again, these are the areas where you want to try to get on top of it sooner than later.
If you're barely joining us, I've been speaking with Dr. Joseph Pergolizzi, who's a pain specialist and well-versed in multiple issues confronting people experiencing acute and chronic pain. And he's been here discussing sources of pain and if you can find out if your pain is caused by viral or just other sources. So can you let our audience know where they can get more information about this?
Sure. You can find out more about common aches and pains and muscle type of strains by coming to my website, drpergolizzi.com. That's drpergolizzi.com, or healthydirections.com.
Well, I'd like to thank you so much for being with us today. I mean, this is definitely some good information. Myself, I've been dealing with muscle pain, and some days I've had it where I've woken up and felt like I did have coronavirus or something like that, and it ended up being just muscle pain. So this is very important, I think.